Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And in this video, I'm explaining exactly what an OTC hearing aid is according to the FDA. Coming up. On August 16th of 2022, the FDA finally got around to issuing their final guidelines for OTC hearing aids after 5 long years of development. The document was 200 pages long and it took forever to get through, but it ultimately indicated exactly what constitutes an over-the-counter hearing aid. This new set of guidelines actually created 2 new categories of hearing aids. We have the over-the-counter category as well as a new prescription category. But of course, for the purpose of this video, I'm going to be covering exactly what makes an over-the-counter hearing aid and over-the-counter hearing aid. But before I do, if you could do me a huge favor and click the like button, it really helps out my channel because it gets these videos in front of a broader audience. And while you're at it, if you have not yet hit that subscribe button with notification bell, go ahead and do that as well because that ensures that you never miss one of my newly released videos, and I release multiple new videos every single week. That being said, I really appreciate it. Now let's take a look at why the over-the-counter hearing aid category was actually made. First, what is the purpose of an over-the-counter hearing aid? Primarily, the over-the-counter hearing aid category was developed to increase accessibility and affordability for individuals over the age of 18 who have a perceived mild to moderate hearing loss. Accessibility will be achieved by removing the hearing care professional from the delivery model of an over-the-counter hearing aid, as well as removing any requirement for a prescription from a doctor. This will allow OTC hearing aids to be sold virtually anywhere, whether it's online, via the mail, or even in a retail store, without the necessity of working with a hearing care professional. Even though technically you will be able to purchase over-the-counter hearing aids from a hearing care professional. The goal of increased affordability will be achieved by removing any services associated with fitting, programming, and servicing those hearing aids. While this regulation will likely have no impact on the cost of prescription hearing aids, it will most likely lead to an over-the-counter hearing aid that is at a lower price point than most prescription devices. This rule will also allow the FDA to crack down on a lot of the unscrupulous online hearing aid dealers and amplifier dealers that are out there that are currently taking advantage of individuals with hearing loss. All right, now that you know why the over-the-counter hearing aid category was created, let's take a look and see what actually makes an over-the-counter hearing aid an over-the-counter hearing aid. And you may want to grab a pen and some paper here because there are a lot of criteria to go over. To start, an over-the-counter hearing aid is an air conduction device that does not require implantation or any surgical intervention. In addition to this, the minimum criteria that must be met in order to be considered an over-the-counter hearing aid are the following. It must be customizable through the use of tools, tests, or software that allows the user to control the hearing aid and customize it to their perceived needs. It may use wireless technology or the use of different tests or self-assessment of hearing loss. It must be made available without supervision, without prescription, without a physician order, and without involvement or intervention of a licensed individual. OTC hearing aids cannot exceed a maximum output of 111 dB SPL at any frequency unless it has input-controlled compression, in which case it shall not exceed 117 dB SPL at any frequency. It must have a user-controlled volume either physically on the device or through an app or remote control. The tip of the receiver must not be any closer than 10 millimeters from the eardrum. It must be atraumatic to the ear, meaning it must not harm the user's ears, and it must be able to be comfortably worn by the user. It must be labeled as an OTC hearing aid for adults with perceived mild to moderate hearing loss. If an OTC device is returned for a refund, it must be reprocessed properly so that another individual can use it, which admittedly is still pretty vague. It must pass ANSI CTA 2051 ElectroAcoustic quality standard requirements. Now bear with me here, this includes input and output distortion below 5%, self-generated noise levels must be below 32 dBA, latency of signal processing must be below 15 milliseconds, the frequency bandwidth must be between 250 Hz and 5000 Hz. And the frequency response smoothness must not have any single peak on any 1/3 octave band frequency response that exceeds 12 decibels relative to the average levels of 1/3 octave bands. These federal guidelines supersede any state guidelines, which means that states cannot restrict anything regarding OTC hearing aids except for the fitting of them, which is still under the jurisdiction of individual states. However, states cannot restrict audiologists or hearing instrument specialists from dispensing OTC hearing aids. So essentially, the professional fitting of an OTC hearing aid could be restricted by a state, but a state cannot prevent a hearing care professional from actually selling them. If a hearing device meets every single one of these criteria, then it can be sold as an over-the-counter hearing aid. That being said, as of the recording of this video in September of 2022, there is technically no over-the-counter hearing aids currently being sold. However, once we start seeing these over-the-counter hearing aids hit the market, me and my team will be hard at work evaluating the performance of each one of them, because just meeting these minimum requirements to be considered an OTC hearing aid does not mean that it will be a quality device. Sure, there will be a lot of bad over-the-counter hearing aids, but I'm going to do everything in my power to ensure that you are an informed consumer, so you know what to consider when looking at these devices and ultimately determine which one's best for you. And since there is preemption, my state cannot prevent me from dispensing these devices on my website, so I can help improve accessibility and affordability for individuals with hearing loss. That's it for this video. If you have any questions, leave them in the comment section below. If you liked the video, please share it. If you want to see other videos just like this one, go ahead and hit that subscribe button. Also, feel free to check out my website, hearingup.com.